Hello, you are all very welcome here today for this Healthy Europe event. I'm delighted to see so many of you in the room, as well as our audience joining us online from across Europe and perhaps even further afield. You are also very welcome indeed. Now, today we're going to be discussing what we're calling an economy of well-being as a key pillar of the European Health Union. Now, I mentioned it's so nice to see so many people because we all know that the last 2 years have been incredibly tough with us unable to meet in person, but with the incredible challenges that the pandemic and the pressures that it has put on member states and on the European Union as a whole as part of the global economy and, if you like, a global health crisis that has impacted everyone. So we're asking today, what have we learned from that? What do we need to build on going forward in order to create the sort of resilient health union that Europe needs for the future? Because without being too doom and gloom, this is probably not the last pandemic we're going to see. I don't want to be quite so negative. I want to take some positives away from today as well. We're going to break today up into 4 panels. We'll be starting out with the panellists here present on a sort of general overview, taking stock, looking at where we are and what we need. Then we're going to break it down into 3 specific areas. We'll be looking at implementing a health and well-being in all policies approach, that kind of holistic view. We'll be looking at bridging the gap at member state level, the international gaps between what's going on in different countries. And last but not least, we'll be focusing in on the Beating Cancer Plan, the EU Cancer Plan, of course, launched right before the pandemic, just in the days and weeks before we were all thrust into a lockdown. So we're going to look at this. We're going to take this high-level session and really dig into it. I do want to encourage everyone to ask questions here in the room. We will get you a microphone. If you're too shy in the room, or indeed if you're following along online from your home office or maybe back in your real office, you can use the hashtag Healthy Europe. Put those on Twitter. I'll be keeping an eye on that online to try and bring those questions to you. So don't be afraid to put them in as we're discussing. We have a tight schedule today, so don't wait until the end of a panel to ask a question. Get them written in early so that I can keep an eye on them and draw them into the conversation with our panellists. With that, I'm going to present to you, we have a video. He can't be here in person, but we do have a special message for us about 2022, the time to translate the European Health Union into a reality. And that is from the Vice President of the European Commission for the European Way of Life, Margaritis, Schinas. Let's have a look at the video.
Dear participants, ladies and gentlemen, first of all, I wish to thank all Policies for a Healthy Europe for organizing today's conference about resilience and also about the role of health and well-being in policy. Strengthening our health resilience has become more essential than ever across Europe. And how could it not be? We live in a time of crisis. We live times that are unprecedented since World War II. For 120 days now, the scourge of war is back. A deluge of fire and steel has fallen on Ukraine, reducing cities to ashes, destroying families and businesses, and bringing millions of civilians on the route to exile. And this keeps happening as we speak. Europe has taken the most powerful sign of solidarity. We have opened our arms to the Ukrainian people. For the first time in EU history, we have granted a blanket protection to all those fleeing the conflict with no home left to go to. This is Europe at its best. And in our solidarity efforts, we are not alone. From all corners of the EU, specifically in the immediate area, people from Ukraine are being offered healthcare, medical treatment, accommodation, schooling, jobs, but also other benefits such as free transport, means of communication and services to parents and traumatized persons. And I know that many of you as NGOs, companies, or as individuals are also heavily engaged in this major, historic solidarity process. We at the Commission wish to commend your work. We find it truly inspiring and absolutely complementary to our own management of this crisis. Dear friends, the war in Ukraine should not nevertheless make us forget another reality that our continent and the world continue to face. We are not done dealing with health emergencies. The COVID-19 virus remains circulating, both in Europe and across the world. It can still mutate and send people to hospital. And at the same time, other health threats are also emerging. Hepatitis and monkeypox. They are spreading and their symptoms can be severe, especially for vulnerable people. And 2 days from now, the WHO will decide whether monkeypox is a public health emergency of international concern. With all this in mind, it is crucial that high levels of investment in health security and resilience are now called for. And we know very clearly the direction where we should be heading. First, we must secure our supply of critical resources and strive toward Europe's strategic autonomy. Europeans will not tolerate, we will not see any shortages of medicines or masks ever again in the European Union. Second, surveillance will continue to play a central role. We must monitor closely the behavior of viruses, their evolution, and their impact on vaccine effectiveness. Third, member states must strengthen their healthcare systems and overall preparedness to be able to cope better both with existing and future disease outbreaks. All this, dear friends, implies change. In Europe, we need a structural review of the way we decide and deal with health threats. And this is the whole purpose of what we like to call a European Health Union, which is now under construction, and which comprises different strands of work. An obvious one is to make our health agencies more efficient and better equipped. For this, we have already strengthened the mandates of the European Medicines Agency and the European Centre for Disease Prevention and Control. We also need to ensure the readiness of the EU with medicines and medical supplies that can be used in time in case of health emergencies. For this, we have created HERA, the EU Health Emergency Preparedness and Response Authority, which, by the way, recently has negotiated the supply of vaccines for all our member states against monkeypox. Another aspect of our health union is to reinforce our legal framework to improve coordination across our member states. For this, we need more effective rules to be able to govern preparedness, risk assessment, and early warning response against health threats. This regulatory work is underway. But, dear friends, beyond the pandemics, we are also addressing one of the main causes of death in Europe: cancer. With Europe's Beating Cancer Plan, we are coming up with proposals to tackle the entire disease pathway: prevention, detection, cure, and survival. We want to bring hope to patients and families, as cancer is a disease that affects us all, one way or the other, directly or indirectly. We also need to have a competitive and fair pharmaceutical sector so that companies can innovate and patients have access to medication at affordable prices. This review of the pharma legislation is also happening. And we want to scale up the digitalization of our health services under a new pioneering European health data space, the first of its kind worldwide. The objective is that people and researchers have better access to health data and improved healthcare treatment across the European Union. Last, but certainly not least, we're also putting money where our mouth is. To complete the health union, we have created EU for Health, the most ambitious ever EU program of transborder investments in health, with an overall budget of over 5 billion euros. As you can see, there is a lot going on. Health Union is not a slogan, it's an emerging tangible reality. Ladies and gentlemen, the world is changing, and the European Union is changing too. Both the war in Ukraine and current health threats show the urgency of further strengthening both our coordination and our resilience. United, we can address citizens' needs and citizens' expectations. Health and well-being are very closely related. Good health is one of the most important elements that matter for people's well-being, while well-being in turn can have a significant impact on people's mental and physical health. Let us honor the call of citizens, live up to their expectations, in particular of the younger generation, for a Europe of health, precisely as expressed also during the conference on the future of Europe. We want a Europe that is fair and prosperous, and to get there, we should all join efforts. All Policies for a Healthy Europe is an important actor to partner with in these efforts. You represent various actors of society, and your expertise on the ground and leverage are needed to make things happen. And the organization of this conference proves precisely how much you want to play an active role. We must continue to stand united to Europe's fundamental values of peace, security, and prosperity. And it is pretty clear that health and well-being are constituent, intrinsic parts of these aspirations. This is the European way of life, the model of society we stand for. And together, we can defend it and promote it. And I'm sure we will. Thank you.
And indeed, we thank the Vice President for taking the time to send that message to us. Now, I was struck by what he said about the European Health Union. He described it as under construction, which very much sounds like someone's out there digging trenches with a shovel and pouring concrete. But that's not what's happening, because a lot of the building blocks are already in place. We're not, fortunately, starting from scratch. So I think this panel, we're going to look at what we have and what we need to build on. So let me, with no further ado, introduce you to Ziger Verkouteren, Vice President of Government Affairs and Policy at Europe and Middle East at Johnson & Johnson. Jan Willem Schneidgrund is Vice President and Global Head of Government and Public Affairs at Philips. Arco Elsman, Managing Director Europe at Randstad Weissmart. And last but not least, Mark Allenson, Director of Business Development at Vodafone Business. Gentlemen, thank you so much for being here. You represent quite a broad swathe of different areas that are affected by the Health Union. Ziger, I'm going to ask you to kick it off. Tell me what you think we need and what your perspective is.
Thanks a lot, and welcome everybody, both online and here in the room. Good to see you again. And as it was said, I mean, the Vice President even referred to emerging. And if you look at the first title I saw of this event was something like the Health Union, a key pillar for the economy of well-being. I mean, we could have stopped after the economy, and people would understand this now, today, in a very different way than even 5 to 10 years ago. But by adding the economy of well-being, in fact, the scope is far more larger. And I think that is really the opportunity we have ahead of us. And I think what the pandemic has been doing is creating a momentum that we've probably never seen before and that we really can build upon. And in a way, it has broken some of the glass ceiling that we used to have when we were addressing this topic at the European level. Because the national authorities really are very keen on holding on to this. But in a way, what the pandemic has shown, they have a critical role in terms of identifying the resources they need, setting up the infrastructure and resources that's human as well as financial resources and what you have. But then they've seen that in order to find the solution, this became a global interconnected effort where science needed to interact with supply chains, with, I mean, the disease was traveling and we needed to get in there to test potential solutions where the disease was active, and this couldn't be done in your own territory as such. And then we saw at the European level, if we wanted to guarantee that no citizens in Europe would be kind of treated differently because either its own government or regional authority would decide something at a given point in a different way, or really they wanted, they were economically not as strong, or they were smaller and therefore maybe not as interesting to negotiate contracts with. The European Union has been able to kind of guarantee that. And then all of a sudden what we saw as well is that the importance of very small, micro, local initiatives like certain apps or certain tools that were come to life to address certain challenges that were popping up. So it's far broader, and it's that holistic perspective that I think that we need to further build upon. And obviously the health union has these 4 big policy areas like the European pharmaceutical strategy, which was already ideated before the pandemic broke, but obviously now the dimensions that are being added to this are very different. And then you have also the European health data space. Obviously, when we are talking about the 2 key pillars for Europe, transforming the economy and more of a digital economy, health cannot escape from this. But now the importance of how do we really set it up around the health data in order to build that potential future for a healthier Europe is critical. The Beating Cancer Plan, I think, is a very smart move as well to bring it closer to designing a health union that is designed for and reaches the people in Europe. Because like the pandemic, now everybody, as the commissioner also said, cancer is something we are all unfortunately, I mean, familiar with in our very near environments, and that we understand of the potential threat. And these are common to all of us in Europe, and we have expectations that are common as citizens. And so there, the Europe to show potentially its value added is critical, because that could be really an opening to far more initiatives in that sense. And then HERA obviously emerged because of all the experience that we built during such an area. So, but there were 3 things that I would say that we have as a vision for the health union. It needs to be, in addition to being designed and in reach for people, it needs to be one that is built on excellence in healthcare, driven by innovation. Because if we don't go for excellence, we better forget it, because people will not be satisfied. And then the second thing is that it needs to be really one that is tangible in terms of how that really impacts the people's life. And that we have felt as well. There is still a lot of bureaucracy that the citizens in Europe are going through, and also when they travel and so forth, that they want to really get a solutions for. And we want an inclusive health union that really is taking stock on the needs of all the citizens. And that's, for example, when you see in cancer survival, if we only had all the rates, survival rates of cancer like Sweden has, and they have nothing, I would say, particularly different as human beings than a Spaniard or whatever, this would already increase the possibility of 250,000 European citizens to survive. So this all together makes that we need to have a good ambition. I'm very positive about the momentum that we're creating now, but we need to further build on it. So I'm happy to further expand on those.
Thank you very much, Sigurd. Jan Wilhelm, let's turn to you. We've talked about the global pandemic. It's brought us home to us how global it is. But we knew this, didn't we? Doctors, scientists, researchers have been telling us for years that we're all interconnected, that viruses don't stop at borders. Can we really sort of find a silver lining? Can some sort of good be born out of adversity in this case?
Yeah, well, I think before we get to that point, we need to understand what we're trying to build with the European Health Union. And I want to unravel the resilience part of it. Resilience basically means that the capacity to recover quickly from difficulties and actually sometimes get out of it stronger. Now, if you talk to a lot of healthcare professionals during the COVID period, everybody said, well, we were really resilient. We were quick to adapt and everything else. And yes, a lot of things went really, really well. We were very quick, we innovated quickly, and yes, we can praise ourselves very well for doing a lot of things very well. Thank you. So, but a lot of things didn't go very well. So for those people that were left behind, women who are really well represented in this panel, or elder people with multiple chronic conditions, it didn't really work out for them that well. We also saw supply chain issues. We still see supply chain issues. As a company, we are suffering from chips. We can't actually make the medical equipment that people need at the moment, impacting 40 million patients this year alone, just from Philips. And the other things that we saw was shameless hoarding of countries, and that is continuing. So the fair allocation principles, the solidarity principles on which a union should be built are nowhere to be seen. So the resilience, building back a better healthcare system, we need to look a little bit more into, so what is a healthcare system again? Now, I'd like to look at healthcare as a building. So you got governance, which is the most important part. That's your foundation. Without the way governments organize healthcare, decision-making, who gets to decide on what, how long, what do we commit to, governance. And then you got finance. We're putting a lot of money into the healthcare system at the moment. Lots of dumb money going into areas that we decided on pre-COVID, and we're going to waste, certainly. Second, the healthcare professionals. How do we strengthen them? We know that healthcare are the most burned out populations in the world, right? The big resignation, they call it in Germany and the United States. Everybody's leaving the healthcare system, so clearly that pillar needs to be strengthened as well. And then medicine and technology. Now, as a technology company, I think we should really invest in technology. The fourth area is data. Now, we already talked about the European Health Data System. We know that the data pillar is really weak. And then the roof, I would like to think as the service delivery. How do we deliver care to our patients? Now, I see that the European Health Union is really like strengthening the pillars with ECDC, with EMA, with the European Health Data Space, with oncology, but it doesn't touch upon the governance. And it really leaves it to the member states what kind of service delivery we're going to organize with that. So we're having really great pillars, which we don't understand what the foundations are, and we really don't know what roof to fit onto it. So the whole thing is going to collapse unless we look at it in total. So when I was looking at resilience in health systems, how do you measure the resilience of a health system in a country? That method doesn't exist. Right? Nobody knows, and everybody can talk about the resilience, but nobody actually knows what it means. So we then engaged with the World Economic Forum and the London School of Economics and asked the London School of Economics to assess and develop a method to assess it and look at that. We've already assessed the resilience of 8 countries across Europe, and guess what? They're all different. They all have different weaknesses. So if you're going to strengthen the European Health Union, you got to start with measuring where you are as a country. Make sure that governance is strong enough so that the pillars can stand upon it, so you build a roof for the patient, because otherwise the whole thing is going to collapse and leave the patient either in the sun or in the rain, whatever you find worse. Thank you.
Well, thank you very much, and for Fabulous for sticking to time. Thank you for that. Arco, doing something collectively at EU level is fraught with difficulty. You know, it's not the first time that joined up thinking has been attempted. We hear all about, for example, the single market, and yet there's pockets of holes all over that. How can we ensure that this isn't the case for a health union?
Yeah, one market. Let me bridge it to work, because I'm about work, and we spend a lot of time at work, so it definitely will influence our work. And what we see with work is that it's organized very locally, even on a company level, not only on a country level, but on a country level. So if we look at an equation, I created an equation. The clicker is not really working. Can we skip to the next sheet? Yeah. So if you look at an equation, it's obviously about mental and physical health. So how are you? Do you have mental problems? Do you have overweight? Do you have problems in your back? That really has an influence on what kind of work you can do. But if you're at work, then actually purpose, belonging, and autonomy are huge influences on how you feel at work. Do you feel connected to the purpose of the company? Do you have trouble with your manager or with your colleagues? Do you have physical problems, and do you do physical work? That's not going to collaborate to really be healthy in the future. So we really have to look at people, how they are, and what work environment fits with them. And then if we look at the pandemic, some things happened there. If you look at the research, then 46% of the people worry about having the right skill set. Automation was already mentioned. So people worry about their future. And if we look at the Maslow pyramid, work is very important to have security, which has a direct influence on your mental health and a direct influence on your physical health. So we really have to start investing in people, in skilling them, making sure that they have the right skills for the future. We organize this now on a company level. Not all companies do this. Sometimes there are sector funds, but they're limited to the sector. So I think we should elevate this to at least the country level, but preferably to European level, to invest in people, to make sure that they're future fit. It's good for Europe and it's good for the health and well-being of people. And if you look at people themselves, everybody is different. And people are not sharing their issues with their line managers or in the company, because that's not safe to do most of the time. I once shared a very personal topic with one of my managers. The guy became CEO of Randstad later, and he said to me, Arco, thank you for sharing. I advise you not to share this with anybody else in the company, because I don't think everybody is as understanding as I am. And that's reality. So we really have to make sure that we create a safe environment for people to talk to. And you see it already if you talk about coaching, it's upcoming. And if I talk to HR directors, to companies, then everybody recognizes we need coaches, independent coaches, to really make sure that people can share their worries, their issues, and that they can be helped to solve those and to move on in skilling, in career development, and ongoing. Thank you very much.
Thank you very much indeed. Mark, it's falling to you to wrap up the opening round. We need skills, we need technology, we need joined up thinking. Give us your perspective.
We certainly need all those things. So we've been experimenting with providing services into the healthcare sector for 10 to 15 years now. 20 million connected medical devices around the world, campus networks for hospitals, drone delivery of pharmaceuticals to remote areas. And whenever we've seen operational services delivering in the sector, it becomes very clear that modern equipment, software, data, connectivity together aren't just a convenience, they're potentially transformational. I'll give you an example. We monitor, on behalf of the Greek healthcare system, patients in remote parts of Greece, on the islands and remote parts of the mainland, and they're able to be cared for remotely by doctors, minimizing the number of hospital visits they need to make, which of course, if you're living somewhere a long way from the regional hospital is a big deal. And also, we're able to get them out of the hospital sooner because, of course, they can be monitored safely outside of the hospital. It sounds simple, and of course it's not, to make it happen, but when you look at the results, they're very powerful. So 3/4 of the patients report fewer visits to hospital. 2/3 of the doctors report there's less congestion in the regional hospital. So it really does work. And as we heard from Vice President Schinas, we need change at scale in this sector in the future. We've got the aging population across Europe. We've got pressure on infrastructure of sorts, whether it's buildings or beds or equipment. And we've got up to 4 million vacancies across the EU in the sector by the end of the decade if nothing changes. So something has to change. And we think this is the right time to make that big effort to digitalize the sector. This is not a trivial thing to do. You don't need me to tell you. But the potential for improvement is enormous. And we think it's worth the investment, and Vodafone plans to double down on doing just that.
Well, thank you. I'm going to remind our audience at home that they can join in the conversation. There is now a chat box that we've got functioning on the page where you're watching. So if you see the little icon with a speech bubble, you can click on that, and please do put your questions to our panelists in there. I'm also still keeping an eye on Twitter. I see some people using the hashtag Healthy Europe. Please do use that. And of course, for this panel as well, you can use Resilience for EU. We'll keep an eye on both of those. Sagar, let me come back to you to talk about, if you like, these 4 different initiatives or pillars or parts of the health union. We've got the data space, we've got the pharmaceutical strategy, the cancer plan, as we said, and the sort of crisis response package. What do you feel I mean, obviously you would like member states to say all of the above are important. Do you think there needs to be a trade-off at member state level on where they focus?
Wow, that's a difficult one, because what would you prioritize? I think it's a bit like was said before. The governance is definitely important, because if we move on all the areas and we have fantastic European guidance from a medical perspective in terms of screening and what have you, and you have data sets and you have all the rules around this, but it's all then coming down, like we've seen with the GDPR, that then still you have a lot of national interpretations and layers being added to this. It becomes like not workable, and really the scale that is being needed is not going to come to fruition. So I think to connect with the population in Europe, I think that European cancer plan, the beating cancer, is an important one, because it will resonate with them. It will, I mean, come close to their heart. But I think in terms of the opportunity that the data, European health data space is a critical one in order to really enable, if we don't stuck at the primary use and just creating a single market for data, but also making sure that there is a system to go into the secondary use. But then, I mean, the whole ecosystem around life sciences and fostering innovation, that's connecting ultimately the medical profession with the inventors, with ultimately patients benefiting from progress in healthcare and pushing really innovation, not for the sake of innovation, but really to drive it where it makes sense that you change the trajectory of disease states, and we manage our health in a very different way. We don't wait till we're ill, but we go in there and we allow progress in approaches that can eventually, I mean, detect very quickly, that eventually we intercept, so you never have the onset of the disease. But then when we have detected it, that we are diagnosing it far more precisely. That's where biomarkers and other thing comes in. So we can align the treatment in such a way that is ultimately giving the best chances, obviously, for treatment and cure, but also for the quality of life, because people also still cherish that. I mean, they don't want to be for life ill. They want the quality of life as well. So I think the four elements come together. And like the Vice President was saying, the health union is not about only managing crises. As we come out of this, our mind is on this. But I think the opportunity is far larger and resonates far better with the European population that have spoken up also in the consultations on the future of Europe. Healthcare, and there were initiatives that the Commission hasn't even started on, like mental health was being mentioned. It's coming forward out of the consultation with the population. So there is an expectation, Europe, you need to do things. We have similar expectations as populations, and so these elements are critical. But yes, I would go with the data one, definitely.
Okay, I'm going to bounce around a little bit. Mark, I'm going to come back to you to build on this idea of data as, if you like, a driver for innovation, and obviously with the connectivity element that you're working on that. How do we look at digital health as a buzzword? I mean, it's become bandied around to mean almost everything. How do you see that, and how does Vodafone recognise the space of digital health as something that can be pushed to deliver actual results on the ground?
Well,
Microphone.
The first thing to say is that it's hard. If you think about an acute care organisation, it's got literally hundreds, if not thousands, of care pathways that patients go through to get treated. And each one of those has to be digitalised one by one. Where do you start? What capacity do you need? It's very difficult to know where to start. And it requires, I think, three things. It requires leadership in the sector that believes this is important, is going to prioritise it, lead by example, and devote the resources to it. It requires the industry to work together across the devices and the software and the data. and including, of course, sharing data sets between organizations, which is why I think the data spaces are so important. And it requires a focus on delivering not the technology, because that's not important. It requires a focus on delivering the outcomes. And that's a mindset that I think the technology industry, and I include my company in that, need to sign up to if we're going to make a difference.
Thank you. I'm going to take, we've got a question coming in from our audience. Jan Wilhelm, I think I'm going to pass it to you. Angelique Mavodaris is asking, she's keen to hear the panel's view on how do we embed sustainability and equity as core population health challenges when it comes to approaching resilience. You mentioned representation, and of course, there's a lot of pockets in that the impact of COVID has hit harder, not just women, not just people with ongoing health programs, but those in poverty and so on. How do we combat that?
So reaching the people that are now not being reached is all about the roof, right? The service delivery. How do you organize that? And we are organized in central hospitals, big central hospitals, who are not geographically, financially, socially accessible to a lot of people, whether it is shame, financial restrictions, bias in the system, you name it, or how we organize childcare, for example. So if you are going to transform the delivery of your services, you move it from the central hospital into the community or to your home environment, that means that you need a complete different infrastructure. Now, if we did a study at Philips with the Future Health Index, where we asked 3,000 health professionals, what are your biggest fears, what are your biggest hopes for, in this case, digitization. Most of them were worried about their staff and burning out. But the second thing they said is, I need to distribute my healthcare towards the communities, towards the people at home. I spoke to a head of parliament of Ukraine 2 weeks ago. I had the pleasure of meeting him when he was asking the member states to allow Ukraine to become a member of the EU. And he said, look, 169 hospitals were destroyed in the war. And so, but I'm not going to build them back. There's no point. I have, however, a digital passport on my phone. I'm the first country with a digital passport. It has all the security, consent, privacy, all of those kind of settings on it to build a healthcare system on top of that. Can you do that? Yes, federated cloud infrastructure on top of a secure platform will allow you to deliver a lot of services. And actually, we're testing that with one of the Dutch hospitals, OLVG, who said, to your point, where do you start? Where we start with hernia. Now, imagine you have a hernia. You want to be operated. You got to go to the hospital a zillion times, yeah, for diagnostics and another diagnostics and another test and another intake conversation with a hernia. Is that pleasant? No. So what we've done is that stay at home. We do everything at home and your remote connections. On the day of your operations is the first day you enter the hospital. Then you go home again. We'll put a patch on your rib here. We'll monitor your vital signs. You don't come back at all if everything goes well, only in emergency. And that's what we're going to do with other, and we make it more complex every time with our gallbladder, and then we'll do ophthalmology, and we'll do all those other things. It is with a federated data infrastructure on a regional basis that can communicate with other parts of Europe, that is completely organized around the patient and the caregiver, taking all the clutter of the hospital into the home. And that, I think, is going to make it more accessible and equitable for everyone. And, to your last point, reduce the carbon footprint of healthcare. In the Netherlands, healthcare is 8% of our CO2 emissions. Globally, 4%. 8% in the Netherlands. So, of course, digitization is also going to allow us to reduce that carbon footprint and truly make it resilient.
And something like that also bridges the rural-urban divide as well, where we see democratization. Before I come to you, Arco, to build on that very point from a workforce perspective, have we any questions in the room? Show of hands, if anyone's got anything burning they want to ask. Not yet. Okay, Arco, great. More time for you to expand on your points. This question of understanding what's going on with people's health. How do you understand what's going on with employees' health? I'm sure that comes down to data and digitalization as well.
Yeah, that's a tricky point, especially if you talk about privacy and data privacy. So basically, you can't log anything. If you look at the whole coaching concept I just described, is that companies and HR wants to know what's happening with the people, why are they picking up on skilling and reskilling, why are they not, why are they leaving, stuff like that. So what we can do is basically anonymize the data and bring it back to HR in a way that they can at least steer their organization. So it's definitely possible, but yeah, not everybody is feeling secure about it at the moment.
Okay, it's your last chance, audience in the room, because the audience online has already had a question. Anyone want to be the first to put their hand up and ask a question of our panelists? No, they're saving. Maybe they're saving it for the next panels because you're. But in that case, I'm going to ask a kind of a quick wrap-up question for each of you. I want you in 30 seconds or less to deliver the message, the key message that you want policymakers to focus on, that you think they may have missed, or that you think just bears reiterating. And Jan will, again, I'm not going to go in a predictable order. Jan, you can start.
Healthcare is local, always. No matter what you do at the European Health Union centrally, we gotta start with the local healthcare system. What is its resilience, and what is the ambition to actually go and improve that healthcare system? Everything else will have to follow in line. If we do it the other way around, we're building the wrong home.
Arco.
Yeah, for me, it's taking the people as a starting point. Everybody is different, and we can have macro views on where we want people to move. But at the end of the day, it's all about the individual, their ambition, their drivers. So for me, it's take the people as a starting point and create funds that are over all the borders to facilitate the people.
Okay. Ziger?
Yeah, be ambitious and dare to really think out of what you've known for decades or even more than 100 years of how healthcare was being set up, because the potential of managing your health over a lifetime and the expectations and the potential that that brings to societies is enormous. So create an environment that is inclusive, that ultimately is driven by innovation and makes that ultimately accessible in very different ways than what we have been doing till today, is really critical going forward.
And Mark, the unenviable task of being last.
Expect and demand leadership on this issue from your healthcare sector leaders. Look for the digitalization plans. Provide the funding to make a start on it. And provide the incentives and regulatory framework that allow the technology providers to make the investments and to cooperate to deliver the right solutions.
Well, thank you very much. Despite, as I said at the beginning, coming from different backgrounds, you've sort of gelled together very well in your four-part call for action there at the end. So thank you very much for that. Audience online, don't go far. We're coming back in just a minute with another panel on implementing health and well-being in all policies approach. Thank you very much, gentlemen. You're free to go. Welcome back, our online audience. Thank you for staying with us. Our next panel is about health and well-being in all policies. So taking this sort of cross-sectoral idea, this underpinning, undercurrent to improve health and well-being across all policy sectors. I hope that will maybe provide the sort of bedrock, if you like, for the sort of joined-up thinking we were hearing that we needed from our first panel. So let me introduce to you our three speakers for this session. Next to me, we have Philip Roux, Head of Unit in the Health Information and Integration in All Policies at DG Santé in the European Commission. Bledin Rees is Deputy Chair of the ECH Alliance and Chair in the Digital Health Society. And George Valiotis is Executive Director, EHMA. Gentlemen, thank you once again for being here. We are again on a very tight schedule. So I'm going to hand it over, Philippe, to ask you straight away to tell us what is the thinking about this integration across all policies. Give us the overview from the Commission side.
First of all, good morning or good afternoon already, everybody. And of course, thank you for the invitation to this conference and to this specific session on the implementation of a health and well-being in all policy approach at EU level. And I think I will try to focus on the so-called One Health and its complementarity with the health in all policies. As you just mentioned, my role, I'm indeed in the Commission responsible for a unit that is looking at health in all policies, in the sense we are looking at health integration in all policies, which is reasonably new in a way. Well, it's not so new in practice, but it's new to have a unit where that is considered directly. And as you certainly have noticed, I have still my mask in my pocket, we had with the COVID-19 pandemic, had an interesting and painful, I would say, opportunity to understand again how and why we need a health in all policy and a One Health approach that really recognize the interdependence between human, animal, and plant health as one, and really in the sense we are sharing the same environment, and here there is an ecosystem we are just part of. We are just one piece of it, and the current monkeypox, I mean, is again a new reason to think that really we are part of the same ecosystem. So that's a very central element for me. And of course, the Commission welcomes and actively, I would say, support the concept of One Health as defined by the One Health high-level expert panel, which is to see it as an integrated, unifying approach that really aims to substantially balance and optimize the health of people, animals, and their ecosystems. I think that's very important for me. One Health principles are deployed in many different policy areas of the Commission. And actually, it's very important to note that it stretches from more recognized fields such as antimicrobial resistance and zoonosis control, but also animal welfare, biodiversity, soil health, sustainable use of pesticide, climate and health. I heard you mentioned that before. Prevention, detection, and rapid responses to future health emergencies. That's certainly one central new development of the Commission in the santé, in the health field, I would say. And for the Commission, the firm belief is that One Health will help to better prevent, predict, and detect, and hopefully respond to global health threats, and that we can promote sustainable development at both global and EU level. So that's what I would say in a short introduction. Thank you.
Well, thank you for that. You had to get through quite a lot there in what is a quite short introduction. Again, I'm going to bounce around, George, and come to you for your opening remarks now.
So thanks very much for having me. And I just want to start actually by acknowledging there's a lot of criticisms we can make of the health system, but I think we really need to always start with its strengths and say that there are a lot of people doing exceptional work. We have lost healthcare workers who have died doing their jobs. We've lost a lot of people who really care about this health system. So it's easy for us to sit here and say, this isn't good enough and this should be done better. And I think we share that desire, but we should first start with acknowledging the work that we're seeing happen is extraordinary. On the previous panel, we heard some really great comments around looking after your workforce and listening to them. And the workforce is telling us they're not okay, and they really need help, and they need more people. And we should start with that. We should start with honoring the exceptional, phenomenal work that we've seen. And I just wonder here, both online and here, who here, put your hand up if your workload is fine? A few of you, oh my gosh, let's swap jobs. But most of you didn't. Like, our workloads have become horrific. And we're all trying to, and I'm hearing giggles of, I think of like, yeah, I share that. So my first thing is we need to look at strategies that make life better for the people who are here caring about our health system. Now, one of the ways that we're here that's happening is through the care strategy, and I've been asked to give a few comments on this care strategy. I think many of you would have already responded to the consultation on strengthening that. And certainly we know that the Commission are intending to publish it soon. From a health in all perspective, and I chair the economy working group, we've got a couple of key points that we think are important to it. One is that we know well-being indicators need to be looked at more in the economy, not just GDP. So looking at increased GDP is great, but unless we see economic, other measures of wellness, of not just richness, but wellness, then we're not going to see success in strategies like the care strategy. And why is that? Because the care strategy is looking for long-term care. It's focusing on aged care and on childcare. We're looking at the full life cycle as the intention of the Commission. So from my perspective, so I work at the European Health Management. Health managers are really the leveraging center point that translate policy into practice. And what they're going to need is the right financing in order to deliver the care that's needed. I've talked about this exhausted healthcare workforce. They can't do it with the right financing. We can have great words in policy, but we need the right resources there. The money by itself is not enough. We need to look at indicators of wellness. I think that, for me, probably establishes what I think is important. We know education is also part of the strategy, and so we'd like to see a better investment in education. The previous panel referenced really well that technology is changing, that things are changing, and that don't just look at technology, but look at your workforce and look at your outcomes. And I think these are the opportunities that we have in the care strategy, and we look forward to seeing how they come out.
Well, Bledin, the floor is yours.
So good afternoon, everyone. So in 2020, the Digital Working Group published a digital policy paper stating that empowering citizens was the key to a successful digital health transformation. This is still true today. This empowerment is critical to citizens living well with long-term conditions, citizens driving the well-being agenda by taking responsibility for their health and well-being. Thirdly, health systems being sustainable and transforming from illness systems to well-being systems. So health in all policies is a simple concept that in every local, regional, national, and EU policy, healthcare should be considered in framing and implementing that policy. So a simple example for those of you not familiar with this, in relation to healthcare, when you look at transport, it has impacts on COPD and asthma. A better way in today's climate to understand this is just to think of the pandemic. So by failing to plan properly for a pandemic, and I would be quite scathing of national countries and the EU, the result is disaster for the economies of every member state, leisure industry as an example, transport. And if you ever wanted to understand why health should be in all policies, you just got to look at the economic impact of COVID. I'd like to see some concrete actions to follow the all health and policies approach. A cross-sectoral approach must be championed by the EU. For example, digital skills and literacy could easily involve financial services and healthcare sectors collaborating together with the education sector. So those of you familiar with financial services and the skills that they have to give to customers to try and avoid fraud, they're the same digital skills we need to see in digital health. The European Union must be real, where member states collaborate at national law levels to foster an EU and digital health market with excellent safety protections and an accelerated access to cutting-edge innovation in products and services. The EU must play an enabling role with this in terms of projects and funding. In any EU work and projects, procurement must mandate interoperability, standards, and that all data generated is used to support the European health data space. I'd like to leave you with a quote from Cicero, which I particularly always like as a lawyer, which is that he said that the health of citizens is the most important or highest law. I would slightly corrupt it to say the health of citizens is the highest policy.
Thank you. We can always find a Cicero quote to any occasion, I think. Let me come back to you, Philippe. I want to get from you to dig into a little bit this idea of the One Health approach. Tell us a bit about that. Where does that differ, or how does that intersect with health in all policies?
Well, I think let's start by health in all policies. And I think for me, what is important here to say is that what we have tried in the Commission was to think beyond the sphere of health. I would say that 10 years ago, we were more looking only on health. And I remember myself at that time being one of these from Luxembourg, crossing the Ardennes and coming to Brussels with my baton and trying to explain to colleagues in other DGs, by the way, don't forget that we need also to think of the health of our colleagues. And that was something that was seen as strange. And so I would say, so the first element for me is, let's say, a vehicle. And I think health in all policies is a vehicle. And One Health, for me, is much more the substance, in the sense, today what we are confronted to and what we see more and more, and you have both mentioned it with interesting examples, we are confronted in a situation when we do realize the hard way how all elements are interlinked. So it's not only to ensure that we think of human health in all policies, but we need to think of the human dimension, to the environment dimension, to the climate dimension, to the animal dimension, to the plant dimensions. All these at the same time. And I would say, so one is a vehicle and the other is the engine. And I think this is perhaps a simple way to address it, but that's the way I see it.
Let me, George, come to you. We're hearing about ideas and the engine and the drivers. Tell me a bit about the sort of concrete examples you have.
Sure. So probably one good concrete example is a project that we're working on, funded by the Commission, called HEART. And so HEART is looking at urban design, and specifically it's triangulating two things. So one is, let's think of the common health conditions like asthma, type 2 diabetes, and other non-communicable diseases. And on the other side, it's looking at how people interact with blue and green spaces. So blue being lakes and green being parks. And by using wearables, they're measuring how do people interact with these, and then triangulating those outcomes to say, is the interaction with these green and blue places giving different health outcomes when it comes to NCDs? So that's interesting because we'll use the data to then influence how urban planning is done, and can we plan our cities more to get citizens more active, to also have better quality of air. And for me, this is probably one of the most interesting practical examples of a health in all policy.
Well, I'm going to remind our audience online again. I'm just checking out whether they've got questions. Do remember, put those questions in under the chat bubble icon. You can send them to me and we will get our panelists to take a look at them. And of course, in the audience, I will give you a chance in a few moments if you have questions. So get your thinking caps on as well. Bledan, I want to come back to this question of what we need in terms of interoperability and being able to work across different areas? Because if we're going to have something that works across sectors, we need to develop some sort of taxonomy. It's a fraught word to use in Brussels at the moment, but some sort of underpinning that we can all work together on, regardless of whether it's standards or some sort of common practice.
So I have to say, I don't understand the problems with interoperability. So at the risk of offending some people, Europe's been talking about interoperability as a problem for 20 years. Talk, 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 talk. Meanwhile, banking just does it. I don't have a problem accessing my mobile account in whatever country I'm in. So healthcare has some sort of problem that it's working with, actually, okay, and it's got a block somewhere that we need to do serious things to. And the Commission need to actually have really hard action, in my view, in terms of mandating some things. But I remember listening to a talk from the chief scientist of the US quite a few years ago, and he said the trouble with things like interoperability and standards, he said it's like a toothbrush. We've all got a toothbrush, but you only want to use yours. And so there's some genuine technical challenges, and countries sometimes see competitive advantage in mandating particular standards that they champion, and that's not in the societal benefit. And in terms of solidarity, we have within the European Union, I think, to try and make real progress and fast. It's not acceptable that we have this massive data potential to unlock innovative services, tackle disease, and actually the impediment is standards and interoperability. So I wish I had a magic wand, but I don't. But I'm just trying to get to the problem as I see it.
Thank you. I just want to react on the spot on what you just said, because you say the Commission talks. I mean, I'm not a talker, actually. I've been forced to be here, so I can tell you, I prefer to be behind the scene and ensure that things are made. I just want to give you one example. If you think of COVID check, I mean, this is something that the Commission ensured to have and allowed a number of your citizens to walk around your own cities, you walk across the borders. So that is one example where we did, and we did in a very short period of time. So not to reject totally the difficulties you have mentioned, I would say that if the Commission talks, it talks with its constituencies, with you as stakeholders, to try to find the best solutions. Sometimes not easy, but sometimes we made interesting progresses. So
and that's a great example, but my challenge to you is, why don't you take all that learning and create a vaccine information system across the whole of Europe, where instead of just COVID, you've got every other vaccine on it, because you've solved the connectivity issues, you've solved the identity issues, you've solved many of the standards issue. Now use that and drive it to its logical conclusion. That's where I credit you hugely for the COVID one, but you didn't have much of a choice. You know, you had to do it, and you did it well, and I agree. But what I'm saying is, now you've got a chance to take that use case and really turbocharge it for the benefit of all vaccines.
Sorry, not for this to be a duo talk. We can have a chat after around a glass of orange juice. No, I think again you're reasonably unfair, because what you have mentioned is true. It's also true that if you think and if you look back, the progress made at European level in the field of health were always around crisis. And it's not because the Commission was doing nothing. It is just because all incident member states decided to let a bit of their responsibilities and power to the Union for that to be possible. So indeed, there are many areas where we could take examples. But we are making progress at the moment. I mean, the European Health Union that we are building at the moment, ERA as a tool, the new pharma strategy. So there are a number of tools that are being put in place that are going in the right direction. And I don't want to fight on that, just open that for more discussions.
Philippe, I know there are no more terrifying 3 words than member state competency, so I'll let you. George, without leaving you out here in the code, what do you see? I mean, I think what Bledden has identified is possibly a lever, a pressure point that we could use at the moment if we take the example of what was done with the COVID data sharing and so on. How do you have a vision or do you have suggestions about how the Commission can take that forward and push it?
Take what forward exactly?
Take the sort of the speed and the interoperability and the joined up thinking that we saw with getting the, if you like, the COVID checks rolled out.
I think it's not that simple because you have to work at the speed of your citizens. And so what we're seeing across Europe is a different pace. We're seeing countries where they're hugely resistant to vaccine, and unless we address that social issue, we're going to see civil unrest in a way that we already did see. So we have to be careful to do that. And some would say, let's just persevere anyway. You can't work to the lowest common denominator. And if you're a private company like a bank and you have the financial resources to deal with a real simple thing of how much money do I have, then there's no complexity. If you have the complexity of people's lives, of people's families, of people's values, of their religion, of their nationality, then it's much more complex. And it's not to say don't do anything, but it's to say you have to work with your citizens' empowerment. You have to start with health literacy and digital literacy, get citizens feeling confident in that. You need some grassroots responses to engagement. At the same time, you need to be, and I think that the care strategy addresses this, you need to be investing in your health workforce, making sure that they have the skills with which to communicate with people. Remembering that health literacy is not the responsibility of the individual patient. We share that. We all play a part in how we contribute to people's literacy. So I would take that approach.
I think probably Bledden will say that the financial sector is a very good example there again in terms of comprehensiveness, the sensitivity of data and the complexity of an individual situation.
Yeah, and I think we've got to start from the basis that European citizens are not stupid, that actually we're all pretty intelligent. We can make our choices, informed choices, and the fact that you might make a vaccine system available doesn't mean that it's mandated. Okay, so if I want to ensure that the HPV in my family is vaccines is registered, that's my choice or my son and daughter's choice, whatever it may be. So I think it's about empowering in that sense. And I think some of these things are not sequential. I think they can and they should be tackled at the same time in order to not to delay. I think that. And I'm going to sound harsh, and I'm not trying to be harsh, but if you've worked in healthcare, as I have, if you have seen the amount of negligence and you have seen the harm done to people because we are not implementing, because we're not using data, for instance, if you understand that, then you do become a bit passionate about, I'm not waiting 5 years. Or if you look at European health data space and you've got a target of 2030, and you're going, what, 2030? Or you look at some of the European member states who don't have digital health. So actually, I don't have digital health records. So actually, they're not even in this conversation. So I'm just trying to be realistic about where we are in the context of trying to encourage more solidarity, greater effort by all stakeholders to try and achieve aims that I think we all unite behind. Nobody wants worse health. Everybody wants better health. Everybody wants better services. So it's a question of how do we achieve that, and we have to do that in a collaborative way.
Yeah, but we just interpret all those things so differently. So, I mean, that's the leadership challenge that we have. I just want to add that I'm embarrassed at how much we become part of the problem. Like, as I sit here on a panel of men, following a panel of men, when we've been talking about equality for like centuries, and yet here we are playing into it and benefiting from that. And so in the same way, we need to check ourselves and engage in health leadership very differently. And I'm not here to agree with the Commission. I'm not for or against its policy drivers, but I think the One Health is really important. And I think what One Health does is it makes us rethink the conversation. It gives us a different way of talking about an issue that we've been rolling around for a long time. So I think I really welcome that work, Philip. And when we had our first meeting to look at what do we talk about today, and we were talking in one direction, and your team were like One Health, and I'm like, oh, didn't see that coming, and I'm glad. I really welcome that approach.
Mark, have you a question? We have questions in the room from anyone? No? No? Okay, well, yes. Jan Willem, can we grab a microphone there?
Well, I like the interoperability discussion, but if we tie it to money, I'd like to get the perspective from that. So we see that a lot of the countries are now spending a lot of money with the Recovery and the Resilience Fund, which has got to be like 25% digital at least. And what we're seeing is that countries like Germany and Italy and Spain, they're all developing their own maturity grids for the digital transformation of their health system. And none of it has really a mature interoperability ambition in that. And so is there not something that the Commission can do, that you'll have the money, but I want you to use this maturity grid and become a little bit more interoperable than you are, so we don't have to wait till 2030 because everybody's spending their money next year?
Well, Philippe, do you want to attempt to tackle that? I know that in the next panel we're going to be looking more at the differences between member states.
Yeah. Well, there is no one straightforward answer to your question. You said yourself, we are at the speed of our citizens. You said we are at the speed of our clever citizens. I agree with both of you. And nevertheless, the situation is that for a certain number of ideas, there is something which is always difficult, is to ensure that all the member states work at the same speed and in the same direction. And that is something, unfortunately, we are in a democratic process in Europe, perhaps one of the most important democracy in the world. And that creates sort of complexity. So what you want to achieve, I also want to achieve every day in my life. I can tell you when I'm challenged by all the member states, when I'm trying to get one standard to ensure that we have the same piece of information. I've mentioned I'm the head of the unit responsible for health information. So I'm working with DGS Stat on trying to ensure that we have the best data available, the fastest possible from all member states, and cooperating with WHO on that and other partners. And it's just an everyday challenge. So we're trying to empty the sea with a small spoon. It takes some time, but we have made progress over the time. And I don't see 30 as a so long way. It's tomorrow. It's just, we are almost there. Therefore, the past, what we have to do, and it differs from one country to another. You talk about banking. Let me that stupid example because I love it. Yes, indeed, we have banks that are across Europe working together, but there are a number of subtle differences between the different countries. And in France, the countries I come from, you can see from my poor English, you have a system where you can use your card only if you put it in the system over 50 euros. There are many other countries, you just put it up and you just dial the code, which is simple. It's very simple. Why hell do we have a different practice? Why people need to have different practices? It's true even in sectors where it should be easy. So it's furthermore difficult in our systems. And I have to say, what I would want, if you have a take-home message, is not this conversation, but more the one on the how we have gone more and more on what else. Think of the farm to fork. Think of what we have achieved in there, how we have been able to ensure that we have the food market in Europe, which is the safest in the world. How have we, thanks to agreement across the member states, to ensure that we reduce pesticides? Not yet enough. But we are in the good direction. Here again, it's thanks to the work that we have put together. We are working on the review of animal welfare legislation. So we are making a lot of progress that, and all member states are not starting from the same point. Have not the same economical difficulty. From certain countries, it's not an issue at all. Like Luxembourg, their production is reasonably limited when you think of animal. But if you think of Ireland or of France, my country, it's another issue, and so on and so on. So I can have many examples of that kind. And I think what we need to is to start again to be positive and see Europe in a positive way. Think of the different initiatives. Health data space, it's also a formidable initiative in the sense it's the first time ever that we are challenging the rest of the world to have tools to do better. With the farm to fork, we have another example, as I've mentioned. The Green Deal is an incredible example. We are forefront in the world, and we should be proud of that.
I agree, you're a good guy. Okay. So the European Commission, I'm not singling out. I think to answer the question, I just think that for a lawyer, it's always really easy. If you give out money, there should be conditions to it. One of those conditions should be interoperability. That's what I was alluding to earlier on. And I think that this has got to come from political will, political leadership at member state level and at EU level, because what you're trying to do is hard. Everyone knows that. If it was simple, it would have been done decades ago. So we all know that. So we must try and facilitate that political leadership across member states and across the union, because I think that's the only way we're going to see the sort of speed that I think we probably all in this room want.
Okay, in this room, have we more questions? Yes, down at the very back, and one over here.
Hello everyone, I'm Gabriella Sutton from EuroHealthNet. Thank you for the very insightful discussions so far. And I think we're pretty much sold on the idea that it's very important to implement health in all policies. But I feel like there's an obstacle with building the investment case for what is health in all policy and how can we translate this concretely so that we can ensure that there are less gaps or no gaps in implementation across national level. What George said about the well-being indicators strongly resonated with me as well. These are concrete ways, for example, to show that investing in well-being is a strong investment for the long term. And that also reminded me of a good case practice in New Zealand, where they actually implement well-being indicators cross-ministerially, and they also have an allocated well-being budget to ensure that there is enough financial resources to establish a community or society that is circled around well-being. So I really think that as a community, as a public health community, and even beyond that, cross-sectorally, we need to start thinking like this to ensure that there's this proper shift. Thank you.
Thank you. Good point and good examples. And I'll take the other question as well, so I give my panelists a chance to choose what they want to answer.
Hi everyone, Michele Calabro, Euriga, European Regional and Health Local Authorities. I have a quick question and I think relates to what was said before. We have the European Health Data Space, which is an amazing initiative. We have the Recovery and Resilience Funds, which are already kind of basically taking over how regions and member states are going to deliver digital in several countries. How do we have a mechanism to make sure that they're not going to go in different directions? And on another level, how can we, as many of us are representing European organizations that work for regions, for example, how can we help eventually the Commission to make sure that there is alignment between what the Recovery and Resilience Funds are going to fund and how the European data space is going to evolve?
Okay, would anyone like to put their hands up to take either of those? Philippe.
At least you see, I'm quite brave in here. At least that's what we can say. Being more serious, I think here you are questioning the Commission's working methods. And I think, may I remind you that there is no one single European law that is passed without it being first subject to exchange with experts from the member states, nominated experts, then subject to public consultations, exchange with the citizen, and I can give concrete example because what I have not mentioned, because you know in my pocket I'm also having the responsibility of the non-food scientific committees, and I can tell you that in a number of cases we are in an active and vivid exchange with citizens on many issues and areas. I'm thinking of tobacco, for instance. That was one where we had received thousands and thousands and thousands of questions on when we were working on the legal text. So I think the working methods are in place for it to be possible. And of course, I could go along it, but it should take the whole day because we also in interaction with the European Parliament, which as it says, and then it goes to Council. So nothing is really in just our own responsibility, and we are not acting in the dark. So I think that the straightforward response would be it. And to respond to you, Madame, from the EuroHealthNet, I think something important that was missing we missed before, it's that we need to think of health inequity also, because that's an immense challenge, and not only across the member states. And the issue of interoperability is also a question that exists within the member states. And here it's again very important to see that what we have to is to push this understanding. And you mentioned in the previous session, for instance, the Beating Cancer Action Plan. One core example, I'm here with my colleagues, we are working on the Cancer Inequality Registry, for instance, where we try to ensure that in the future we'll be able to see the differences not only across the member states, but also within the member state in how you access to treatment, how prevention is organized, and so on and so on. And that is certainly among the priorities for future for us.
So if I can pick up the first question. So I think it's a great question. And in the first panel, we heard comments about the fact that resilience is not outlined. So how do you tackle that? I think the saying from the business schools is you get what you measure and reward. And clearly, in terms of some of the things we're talking about, we don't have those metrics. In the economic working group, they started to look at what metrics there should be for that. So I think there's a number of organizations looking at this, but what we need is to coordinate it if we're to have sensible policy making. On Michele's question, I think we could talk about that for quite some time, I fear. But one interesting thing I'd say is that if you just look at the GDPR implementation and how that diverged and the problems that has caused, which is illustrated in the Commission's report that they commissioned, I think that actually Eurega's got a role to play, personally, because I think in terms of some of the use cases, the early use cases, particularly for the European health data space, I think if we can collaborate and coordinate regions to actually work together to provide that first evidence, work out things together, lessons learned, that would be a fantastic thing to do.
So thank you very much. We're getting towards the end. George, I'm conscious that we haven't thrown too many questions at you in this round. So I'm going to give a quick wrap up of what people have been saying online and let you comment on whichever of those you like. Angelique again has been asking about whether there's an opportunity with the current energy crisis, the cost of living crisis, the obesity crisis, to align agendas through a health and all policies approach. What are the opportunities? Sam Voten is also asking what the role might be for the pharmaceutical industry regarding primary prevention, pointing out that even though it's not a central part of their business yet, we do see some pharmaceuticals moving towards this fight of non-communicable and preventative diseases. And then Carolina Makiewicz, thank you very much, Carolina, has pointed out in relation to that last question that there are some great examples of the investment cases about the health and all policies in the World Health Organization's Healthy Cities Network. So check those out if we want some more examples. George, you get the final word.
I appreciate it. I didn't want to fill the space with words just because I'm here, because I actually agreed entirely with the responses happening, especially to Michelle's question about the well-being indicators. We need consensus on that. We need different conversations about that. You know, we're using measures like GDP and employment, and we need to have a very different conversation. So I think that the examples shared online of looking at the WHO already have some good thinking on this, and otherwise we need more collaboration.
Well, thank you very much. And thank you once again, gentlemen, for this rapid fire. We are cramming so much in this afternoon. Thank you all again very much. For those of you online, stay with us. We're back in just a few moments with another panel looking at the different gaps between member states. Our next panel this afternoon, I've mentioned several times, trailing it, we're going to be looking at bridging the gap between the EU and national levels as one of the keys towards moving towards an economy of well-being, looking at how the EU as a whole, its institutions and so on, can help member states create a virtuous circle where they take citizens' well-being into account as part of the overall look at economic prosperity, stability and resilience. A quick reminder to those online, keep putting your questions in. We know you've been doing it. Use the hashtag Healthy Europe, use the hashtag Resilience for EU, and keep those questions and thoughts coming. Thank you for those of you in the room. I often say these events are more like a marathon than a sprint, but this one feels just like a series of sprints because we're on high speed again. And so I'm going to turn away straight away to introduce the speakers here in the room. I'm delighted to have with me Veli-Mikko Nimi, who is Director General of the Department for Communities and Functional Capacity at the Finnish Ministry of Social Affairs and Health, and also Jérôme Arnaudis, who is the Air Quality Director at Suez. And joining us remotely, I believe we do have connected, thank you very much indeed, Birgitta Sakredus, who is from the EPP Group and Chair of the Interregional Group on Health and Wellbeing at the Committee of the Regions. Birgitta, thank you so much for joining us. I know you were prevented from travelling, so I'm going to give the floor to you just to give us your overview on what you would have said in the room on this panel. So over to you.
Thank you. Well, health is wealth. We could hear that from the people on the that talk today. Especially the COVID is shown that it's really dependent on your health if you will have a good economy. And Eurostat had some statistics last week about the life years at birth, health life years at birth. And there it showed that in general, in the EU countries, it's around 64.5 for women and 63.5 for men. And when it comes to Sweden, it's 72.7 for women and 52.6 for men. So, I mean, it's really difference in between the years. So we need really to work together within the EU to get it better. And 19 out of the 27 countries, it's the regions who are responsible for the health issues. So we really need also to talk about the regions, not just about the member states and EU, also the regions, because so many as 19 out of 27 is the regions that are responsible for health issues. And of course, we need to talk more about prevention. I think that we should talk more, because only 3% is due to work with prevention. The other things are curative, like 97%. And earlier today, it was discussing about health literacy challenges. Well, I think Europe has come very good when it comes to tobacco, the smoking. We smoke less, and especially not in restaurants. Who thought about this before? But we also need to work with obesity, physical activities, and also that is what has not been mentioned so much during this time is the growing mental health problems. And it's a big stigmatization when it comes to mental health. I think we have to discuss that too. But today also it was discussed about digitalization, and that is so important. And especially in sparsely populated areas, I think that's really the future, that we have more of digital healthcare. And Europe has also worked much with active and healthy aging, because we know that there are more people that are becoming older in Europe. So healthy and active aging is so important that we try to do so people can be more autonomous when they get older. So assisted living with good technology will make people healthier and autonomous in the future if we get the elderly to get more of assisted living. And EU has done a lot in that field for people's well-being, but I think that it needs to be more, as was said before, in policy and in decisions making. And through this, I really hope that we work together for a better health. And then it will also, of course, will be more of good economy in Europe if we work for a better health. Thank you.
Thank you very much indeed, Margaritis, for joining us. I know despite the small technical problems. Veli Mikko, I'm going to ask you to give us your perspective. What has been the Finnish experience?
Thank you all. And first of all, I have to say that I'm very pleased to be here, since we have had a lot of cooperation with your organization. And I remember very clear the first event we had here, was it 4 years ago in Brussels, to start this nice journey, which is not yet in its goal, if it never ends there, but there has a lot happened since then. Of course, as was mentioned in previous panels, this unfortunate COVID pandemic has been a kind of a real exercise of economy of well-being. It has really shown how interdependent are elements of well-being, this time health of people and the economies of nations. And it clearly shows also that the measures done so far and planned are also needed in terms that we really can create something which better balances well-being policies and economic policies. And we can better use the tools which are already existing, like in the European semester, that how we can balance economic policies with well-being policies. Well, that said, in the European setting, of course, we need to also act at national level, and we need to preach what we pray. In Finland, we have followed the Council conclusions in a way that we are preparing our first National Economy of Wellbeing Action Plan to be adopted by the end of this year, and preparing somehow next government's program. We are going to have elections in 23 spring. But always one has to keep in mind also this old slogan that think global but act local. And as it was mentioned also in previous panels, finally it's always a question about individual citizens, customers, and they are citizens of a municipality, of a region, of a country, and of the European Union. But it's always the same people. So we have to have people-centered policies. And one big challenge and opportunity which we are facing in Finland is the starting of our new health and social care regions from the beginning of next year. They will have a yearly budget around 22 billion euros a year. And now, of course, that can be done in a very technical way, and we need high quality services in the future as well. But this is also a big opportunity to let these new regions, which have an autonomous administration, to create their own strategies. And many of these regions are already also adopting the language of economy of well-being in their strategies. So we have plenty of tools in many levels, and I at least believe that you can use this concept in many of these levels. Thank you.
Thank you very much. Jérôme, you're coming at this from a different perspective. Tell me where your work intersects with what we've been talking about today.
Yes, definitely. when we talk about well-being, more and more today we are talking about air pollution or air quality, depending on where you are living. And in fact, I will start with this figure, 7 million. 7 million people in the world are premature premature death per year, according to the World Health Organization. So 7 million people, premature death per year. When we talk about, or when we zoom in Europe, we're talking about 500,000. And we know that today air pollution kills more than malaria, more than AIDS, more than alcohol. That's why we call it the invisible killer. And above of the human impact, the huge human impact of air pollution, there is a cost for our society. In Europe, we are talking about hundreds of billions euro per year. And so the figures are so big that it doesn't mean anything for me, for you, for everybody. So I will take some example. In Bucharest, it costs 3,000 euro a year per citizen. In Milano, it costs 2,600 per year. In Paris, 1,600, and so on and so on. So you can do a lot of things with this money. So I'm sorry to start with these figures, because I want to be also optimist. And I have good news. The first one is air pollution is improving for years now due to the past action we did. We need to go further, but we are in the good direction. The second positive thing is that solution exists and more. And so that we have a wide range of solutions that we could put in place at our level, at government level, at city scale level. Because as you said, we have to act locally. And the third one, and this figure is coming from the US EPA, so the US Environmental Protection Agency. It's a good investment. Investing in air pollution fight is good. And investing $1 bring you $30. That means that it's a good way to invest and to put money in order not only to save money, but above all, to save lives today and the one of our children tomorrow. So in Suez, we are an environmental service company, and we are working for years now in the air pollution or air quality sector in order to improve and to bring solutions not only to government, cities, but also to industrial. And I'm sure that government, I'm sure that cities, I'm sure that all the stakeholders are ready to move forward. And I think that it's now important to speed up in order to stop this invisible killer. Thank you.
Thank you, Jérôme, indeed. And I think you identified what was said on our last panel, or even our first panel, which is that health is local. And indeed, it's not just even at a member state level. It's specific when we talk about something like air pollution. That's not even necessarily at a regional level. It comes down to very local, to very metropolitan, specific city areas. So, Birgitte, I want to talk to you about the different regions and deciding, how to put the focus in different areas, because it's not just, although Jérôme gave us some alarming figures about premature deaths, it's also about the quality of life, even as you have it, which can be deteriorated because of poor environmental factors. So Birgitte, I'd be interested to hear your views on living well as opposed to just saying that living at all.
Well, that is a deep question, and I think that you have blue zones, it's called, and that is what a human being need for having a good life, and the blue zones are somewhere especially I think it was in Sicily, and there. To have a good life is more than just
Oh dear, it's a bit frustrating, Birgitte. You're breaking up a little bit. have a stab at summing it up shortly, so hopefully we won't get interrupted.
Okay, so blue zones, that's where you have mentioned where it's scientific, why people live longer there and have a good life. And there it needs to have, you have a social life and you eat well. And so I think if we look more on these blue zones, how we should live, then we can live longer, actually. That's my answer. Thank you.
Thank you, Birgitte. And obviously, Wi-Fi underpins all of these things so that we can connect well. Let me come back again to talk about, we were talking about disparities. And I know, Veli-Mikko, that you're working on the National Resilience Recovery Plan, and you're looking at this economy of well-being component that I think was touched upon just at the very last end of the last panel. So I'm interested to hear about how the different elements you bring together as part of that. I think I have notes here telling me you've got 3 dimensions, but tell us what they are.
Well, yes, we have a health lens in our recovery plan very strongly within. But what we are in particular focusing is just this, how we follow up and how we measure the achievements. It's easy to say, but in practice it's often, first of all, you need a sound databases. Well, we are well advanced in Finland in that way already, but still there are progress to be made. And then there is this analysis phase. What kind of indicators we can create so that also the policymakers can follow the results, not only scientists. And there are gaps which we are now filling with also this RRP money. And in fact, today a group of researchers in Finland released some results on their study, which is linked to another reform, which is our social security system reform, because there is even more that you can get equal data and equal evaluation of results of what if you change the social security system, how it does affect different population groups. So I think these all combined together and very well placed on the all policies for Health Europe theme. There are many sectors in policy which have an effect also on health. Thank you.
Thank you very much, Veli-Mikko. Have we any questions in the room? I see one, Darren. And a reminder to those online, please use that chat box function to put your questions to our panelists.
Thanks, Jennifer. Actually, I'm going to be cheeky as an old journalist and ask 2, but they are related. The first is, Veli-Mikko, you mentioned the Recovery and Resilience Fund. Obviously, we had a 20% reference to digital transition, which, of course, we all very much welcome. We saw the 38% with regards to green. But do you think, actually, now there's a discussion about an RRF 2.0, given what's happened with regards to food security, energy security, but also health security and resilience that we talked about earlier? Do you think that now is the time to have maybe more specific and a dedicated amount of money dedicated to health resilience in a future RRF? And then secondly, obviously conference on the future of Europe. You talked about the gap between member states and Brussels. At the core of that, of course, is the ongoing, never-ending discussion around competence. Is there now an opportunity with the conference on the future of Europe, for example, to potentially look at potentially a treaty change and increasing the competence here in Brussels on health?
Okay, in the interest of time, Veli-Mikko, I'm going to ask you to tackle that. The Recovery and Resilience Fund, does it need an overhaul? And then I'm going to come to you.
I would answer both of these questions by saying that the best would be to have a long-standing answers. So, of course, the RRP money is only short-term money. So you should not live on it. You should create something very concrete and long-standing. And the same applies, at least personally, I think, for the competencies. I don't know if it's really energy is useful use of energy to continue this debate on what are the competencies. Just do right things and obey the competencies. That would be my answer. Thank you.
Jerome, what's your perspective on the EU and national governments and perhaps what we've seen, the actions and the suggestions from this conference on the future of Europe?
No, I think that, as we said before, we need to act locally, but it comes from also guidelines coming from ahead or the EU. I will take one example. When we talk about air pollution, we have in EU some norms. Last year, the World Health Organization updated the guidelines. And in EU, we have to update these ones in order to update our norms. And then the state, the country, will have to follow and to respect these norms. Now, where we have an issue is on the financing, because at city scale, regional scale, country scale, they have a lot of obligation, but they don't have so much money to spend on this subject. And I think that we talked about before digitalization, measurement. That will allow us to measure the air pollution, to measure the actions, not only at regional level, not only at European level, but at city scale, at street scale. And doing so, we'll be able to not only follow the actions and adapt them, but also to be proactive. And this is what we said before. We need to be more proactive. We need to have more, I would say, prevention in order not to treat the problem, but to avoid the problem. And I think that today, that's what we need to, the gap we need to fill. And we have these common drivers when we talk about the different topics we talked about this morning, this afternoon. Doing so and breaking this gap between global and local will help us to move on and to improve using digitalization.
Well, thank you very much. I know it's been a very brief panel, but I'm glad all of you were able to join us. Birgitta, thank you very much for joining us remotely. Jerome, Veli, Mikko, thank you very much, gentlemen. Online, stay with us for another panel.
Tell me, ain't you tired of hating every day? There must be more to live for than to be hating everything. Well, it won't make you look weaker. You can kill them with your smile. It will only make you stronger. The more that you play nice, to be walking with a heavy heart. I'm the one, no, 'cause I got to let you know this home is mine, is my religion. This home is mine, is my religion. This home is my religion. This home is mine,
And our final panel today is, of course, on that EU beating cancer plan. Someone think that we have been discussing over recent years, but perhaps it's been a little bit overshadowed by the pandemic. I remember very well, it was the last big event where we were all in person right before lockdown for many of us here in Brussels. And of course, it was to form a centrepiece of the European Commission's health plan. And it is still very high on the agenda, obviously, but I think it's worth looking at it now within the context of us coming out of the pandemic. And we're delighted to have you here in the room to discuss that. I have Adela Magia, who is the Senior EU Affairs Officer at ECPC, and Gianluca Casali, who is the Medical Director for UK and Ireland's Johnson & Johnson MedTech. But before we even start with that, we have a message for us from the member of the European Parliament, Sarah Schinas, who was not able to be with us, but she is the Wellbeing Ambassador on all policies for a healthy Europe in the COVID Committee in the European Parliament. So she has sent this message.
Hello everyone, thank you very much for the invitation to being here with you today for this Beating Cancer Plan, an holistic approach to renew EU intergovernmental cooperation in the areas of health and well-being. First and foremost, the European Beating Cancer Plan had a report by the European Parliament where we clearly stand our position in the importance of tackling the known risk factors to address in regards to prevention and beating cancer. We have now that currently we only know 50% of the causes of cancer, hence the importance to tackle research and find out what is the other half that is causing cancer for our populations. For this, it's important to plan and the intergovernmental cooperation potential, which is a key focus on the implementation should be the importance to tailor policies to the different populations, meaning involving patients and communities in order to better understand how to adjust broader frameworks such as the EU Beating Cancer Plan to specific population needs and circumstances, especially when it comes to accessibility and equal accessibility to optimum cancer care across the European Union. Also, just here a note on the need to have important and longitudinal assessment plans on the implementation of Europe's Beating Cancer Plan in order to have clear data, clear indicators on the progress of the best practices across the 27 in order for us to have better evidence in order to tailor suit better and improved evidence-based actions. In regards to the economy of well-being and how can the economy of well-being help in providing EU governments with the necessary means to achieve a successful and effective European Health Union. Here at the EU, specifically in the Parliament, I have been one strong advocate on the need of having a European Health Union. And the economy of well-being is a cornerstone at the center of it, because when you apply public resources and allocate them for the improvement of people's health and well-being, that means that people will be healthier, will be happier, will be more innovative and productive. And there's a need to have better coordinated organization of member states on regards to public health. Because as we all know, public health protection is a shared competence between the European Union and the member states. There also needs to be coordinated investments in improving the quality of life of citizens in the EU, and this will lead to a significant boost in economic growth. The pandemic, there's many lessons learned with the pandemic of COVID-19. One of the biggest lessons is the importance that health has in our society. I'm not saying the importance of disease or healthcare provision. I'm clearly stating the importance that health has in our society and how it affects the different levels of it. So the fight and the work for healthier and happier populations is indeed the ultimate goal and should be the ultimate goal of the European Union's when we have a better coordinated response to healthcare crisis, such as the one that we are doing now with the new legislative package of the European Health Union, with the increased mandate of the European Center for Disease Prevention and Control, the European Medicines Agencies, and also the revision of the regulation of the serious cross-border health threats. This will enable the 27 member states to be better prepared and respond together to health crises, to have availability of medical and medicinal products available, and work together in order to improve prevention, preparedness, treatment, and accessibility to care for diseases such as cancer across the EU. Once again, thank you very much for having me.
Okay, thank you very much indeed, Sarah. Rather abrupt ending there to that video. Adela, let me turn to you as you know, the representative here today from the European Cancer Patient Coalition. Are we doing enough? What's your perspective? Has the work been derailed, as we maybe suggested? Give me your opening thoughts on where we're at this juncture in time.
Okay, so thank you. So I do represent the European Cancer Patient Coalition, that is the voice of people with cancer in Europe and beyond. We have over 450 members in 49 countries. And I must say that when the plan was published by the Commission, we were very pleased to see that, and here I quote from the text of the plan, that it places the interest and well-being of patients, their families, and the wider population in its heart every step of the way. That's what the Commission says. It's also encouraging to see that the plan focuses on the multidimensional impact of policies in the areas that are important for well-being, and this is health literacy, digital health literacy, but also quality of life, delivering higher quality care, equity in terms of access especially, and also social protection if we think of the right to be forgotten law, for example. But patient centricity, together with health literacy, with equal access to medicines and also to innovations and all the aspects that I've just mentioned, are promising actions, if addressed properly, to tackle the burden that cancer poses to European citizens at the moment. And also, if such actions are implemented in a proper way, it will help us revert the dramatic burden that cancer is said to become a leading cause of death in Europe. But if we look at the whole landscape, we see that it's great to have like common goals at the European level. And it's also reassuring to see the ambition and the leadership that has been put in the European Beaten Cancer Plan. But the question remains how to make this successful at the national level, because that's where the patients are. And now the steps following the European strategy would be to drive forward some actions that are required to implement the ambitions that are set in the plan, and in parallel to measure success. And this has to happen at the national level because, as I said, that's where the patients are. And when you try to do this, you are facing some big challenges, and these challenges come also from inequalities. And these inequalities exist both across the member states and within the member states. And on the top of this, we are facing the COVID crisis and the war crisis. So the question is how to build resilient systems, that resilient health systems, of course, that are able to cope with such shocks. And I think that one of the most important lessons that we seen from COVID-19 is that there are times of disruption when we have to make decisions fast, but we also need to adapt to the challenges as they come, and we need to do all this together to offer the right solutions to patients in real time. I will stop here with the introduction, and I'm happy to continue the discussions.
Well, thank you very much, Adela. Gianluca, you're working from the perspective of Johnson & Johnson. Give me an idea about what you're seeing as the major challenges in fighting cancer and whether that has evolved.
Yes. Can I maybe step back? So I'm a cancer surgeon. I joined Johnson & Johnson in December 19, so just before COVID. And so I'm particularly close to the topic. And I think first things is, why do we need a cancer plan? And my answer comes in two numbers. We have 3 million new diagnoses a year of cancer in Europe. And we have 1.9 million deaths for cancer in Europe. So these are two staggering numbers. What is even more shocking to me is the WHO says that 40% of the cancer deaths are preventable. And we are all old enough. I'm sure every one of us had either family member or friends ending up having cancer. It almost means that out of the people that we know who died for cancer, at least 1 out of 2 could have been saved if we did something different. Now, are we done something good, something bad? If we go back to year 2000, so when we were all worried about the computers not updating and the clock going crazy at turn of the century, mortality for cancer was much higher. So mortality is now down, is reduced, and is reduced because we have gradually introduced screening at a broader level. We have better diagnostic system, we have better treatment. But if then I ask myself, the question is, are we where we want to be? And what is an acceptable mortality for cancer? Now, I answered the first question as I'm not where I want to be, and I don't think anyone can say that. And an acceptable mortality for cancer to me is 0. Now, as much as it may be somewhere in the future, the faster we move, the closer we move, the better it is. So there is a degree of urgency. And I think the cancer plan give a direction to the entire Europe, and I think that is great. But there is a huge role to play at every level. So we've been discussing, yes, European Union, and then there is country level, and then there is regional level. And we all know that the different healthcare systems in Europe are very complex. So there is a role to play at every level. And going back to the challenges, the original question that I finally answer, I think there is something about data and is knowing for real what is happening and maybe possibly in real time, not 2 years later. There are pathways that are patient-centered, and maybe that is another challenge. Different countries, different patients, different cities will have different needs. How do we know what they want and what are the real needs? And then, for sure, inequalities. And inequalities is in between different countries, but there are significant inequalities within countries as well. And here I stop.
Well, thank you very much. I think you're echoing a lot of, in fact, what we heard said on previous panels. Do you want to build on that straight away without a directing question?
Well, yes, I think it is important to look how we make this plan, how we turn it into reality, and yes, how we tackle the death burden. And I think there should be a different mindset at the EU level, and also a different mindset among the stakeholders in order to drive the change here. Because I think we need definitely to build a value-based health system at the EU level, and also incorporating the national contexts, and also to have a resilient and also a patient-centric approach. And when I say the need for a value-based system, we need to create incentives and investment capacity for high-value interventions and innovation, because this can improve the patient and the population health outcomes in the long term, and this can happen including, of course, the primary, the secondary prevention, and also by disinvesting in low-value interventions or in wasteful interventions, and also building on this value-based health system. At the core of such a health system is definitely a people-centered health system that builds on informed people and informed patients. And patients and people at large, they should have access to reliable health information, and they should have access to their personal health data. And health literacy and digital health literacy are important players, because they can strengthen the health system, especially at crisis time. And also, I think that care services should be based on patient-reported outcome measures and experience measures. And I truly believe that there should be a health system that understands and monitors the patient's needs, the patient goals, the patient preferences, and that embraces the shared decision making, and also co-creates care together with patients, because I think this is the way to resilience.
Thank you very much indeed, Adela. Have we questions in the room as yet? And a reminder, I think our online audience, we have no questions formally yet, but we'll go here. Okay.
Hi, my name is Filip Karan from IFA, the European Public Health Alliance. And I was just wondering, what are your thoughts on kind of using digital technology for diagnostics and screening of cancer? Do you think this could improve patient outcomes? And do you know any statistics on to what extent is misdiagnosis and improper treatment results in cancer mortality? And also, kind of related to that, well, since the cancer usually, well, disproportionately affects people who are older, who tend to have other comorbidities. For example, if I think of my family members who have cancer, they suffer from other conditions as well. And how do you also think that, what to do in those situations? How do we address those cases with multiple comorbidities and cancer?
Quite a few things there touched on: diagnostics, comorbidity, misdiagnosis, I think was another issue you raised. Gianluca, perhaps prize them apart a little bit and tell us what your experience is.
Yes, there is lots in it. So I'll skip the misdiagnosis bit and I leave it to the litigation lawyers that are in the room for a conversation after. Yeah. So in my head, there is something about focusing on where there is a relatively easy win. So, or where there is no win. When we have cancer that present late, there is no easy win. And we have major advances in pharmacology, new drugs, targets, therapy still. Most of them just delay the inevitable, okay? And sometimes ensuring a decent quality of life. So I think it is amazing. If we move to the other end, where it's very easy to treat a cancer, also the very, very aggressive. And we can take a skin cancer, melanoma. You know, metastasize is almost a disaster. It doesn't. You just take it away. Gone. But if you go one step backwards, and it's maybe even easier to prevent it. And for melanoma is straightforward, use sun cream, you know, especially if, and we can use the same model for many of the other cancers. So in my head, why don't we start considering shifting the heavy investment that we have in healthcare and in social care at the end of life? We start shifting that budget towards investing towards the prevention side. And now, again, cancer plan, there are amazing insight in there. There are cancer for which we had amazing results in Europe, and you say cervical cancer, breast cancer, colorectal cancer. But those are also areas where there is a huge inequity of access. And if we compare the poor countries where access is poor to countries where access is best, and I quote the best, Sweden, we have an incredible disparity in outcome that then translate into a difference in life expectancy that is about 10 years. It is a wow. Yeah, it is a wow. So,
yeah.
Yes, so maybe I can add something on the cancer-related complications and comorbidities. The EU Beating Cancer Plan mentions the National Comprehensive Cancer Centers, and these where the patients can be treated by a multidisciplinary team, and this is key to treat these complications and comorbidities. And definitely such centers need to be expanded because they can't be found in many countries across Europe at the moment. And these, together with the European reference networks, are the backbone for a well-functioning plan. Because if patients have access to these, then also we can tackle inequalities across member states. And then in order to make both the comprehensive cancer centers and the European reference network work for patients, we need to have some cross-border cooperation between these establishments. And I think this is key at the moment.
Thank you both. Have we any more questions in the room? Yes, Jan Willem. Behind you. Oh, no.
I'd like to understand whether in Europe we have the best cancer treatment system in the world. And as J&J was a global remit, we talked. You must see these different areas. You just said Sweden as the best, or has a survival rate or expected lifetime 10 years bigger. And if we then look at how we organize prevention, diagnosis, treatment, the role of data, the role of equity, the role of excellence, as your colleague was saying, and the role of how we share information and learnings cross-border, where would you develop your best treatment as J&J, in which country, and where would you actually apply it to the patient because you get the best outcome? And then, of course, Adela, you can tell me where you want to be patient. Best place to be a patient.
I bet you the answer to that is it depends.
Yeah, so I'm still not been promoted to assessor of healthcare system in Europe, but maybe there is a new role that is going to be advertised this afternoon. I don't know yet. So I think there are some common themes where. And there is extreme variability. So I don't think you can quote a single cancer. I think Nordics, they tend to have overall a better system. Why is a good question. And I don't know. The why, I don't know. Overall tend to have better outcomes. They are heavily focused on science. They are highly collaborative. And if I have to quote, maybe not the right country here to quote it, but an upcoming country in terms of scientific production and collaboration, the Netherlands, where you see what Adela was mentioning clearly is multidisciplinary team working around what patients want and patients need. And paradoxically, an healthcare system that is supporting financially these sort of activities. So payments are matched to patients' outcomes. And I think that is key because there is an incentive to produce high quality science, but the high quality science then is implemented in the system that produces it.
And anywhere else outside of Europe that struck you as being worth mentioning?
I'm a heavily European based. I'm Italian, as you can recognize from the accent, and I worked in UK. I don't have direct experience of other places, so I'd rather not comment.
Fair enough. Adela, yes.
Maybe I can add something. I think these discrepancies that we see from north to south and from east to west are also due to the fact that even if we have now political will to legislate on health at the EU level, the Commission and the EU bodies haven't yet assumed a leadership role. And then the member states are given some recommendations, some directions to follow, but they are not given enough leadership and enough support to implement certain aspects. And I think here we still have some work to do.
Well, I don't see any other questions in the room or online. I'm conscious of the fact that we're on the very end of our fourth panel and we've got through a lot today, but just to be a bit provocative to finish up, I always like to interrogate an idea by thinking about its opposite. And we say we want a patient-centric healthcare system or cancer care system. Well, that to me sounds obvious. As the Americans would say, it's a no-brainer. Who wants a healthcare system that doesn't put the patient at the centre? Who does that serve? So I'd like to think, who might it serve? Who are those obstacles? Who are those competing forces? And how do we actually deal with the challenge of them? Is it big pharma? Is it governments who don't want to put their hands in their pockets? Is it ignorance or a poor education system? What takes the patient out of the centre? If we spent so much time saying we want a patient-centric health system, what's the alternative? Why is that a revolutionary idea?
I think it is a revolutionary idea because we have been talking about value-based healthcare for a long period of time. And the key question is, what kind of value are we talking about? And I think we need to have a direct question to patients. What do you value in this moment? And maybe what do you value as a citizen, before even you become a patient? And I think that is where is the key. There has been lack of data because it's been extremely difficult to collect patients' reported outcome, patients' experience outcome. And now I think the data are becoming easier and easier to collect because there are proxy of what is quality of life. That is, for example, you move, what do you do during your day? Do you step from your bathroom to the room, to your bedroom back and forward, 20 steps, or are you able to walk and enjoy a social life that is part of the well-being? And those data are becoming collectible. So there are proxy of what is valuable, and then there is direct questions that is to every single patient that comes through an healthcare system that can be asked, and that can be facilitated by again, digital solutions that allow patient to directly feedback. You build, you recognize excellence, you recognize variability, you build and move towards the excellence. That is my hopefully straightforward answer.
And Adela, same question to you. Who or what is it that might be pushing the patient out of the centre, and how do we pull that back?
I think it's the lack of collaboration and coordination because I think it's time to have the patient at the same table with the policymakers, with the industry, with the academia and the research community. This happens not so much, unfortunately, and I think this was missing from the policy landscape, and that it should be there for sure.
Well, thank you very much, and thank you for both of you for joining us. I know at the end of a long afternoon. Thank you very much, everyone here, for your input, for your questions. Thank you to the audience online for your great questions as well. Please keep the conversation going. Use the hashtags Healthy Europe, hashtag Resilience for EU as well, so that we can continue this beyond the confines of this room. But once again, a big round of applause for everyone for everyone's involvement.